learn, decode very important remedy in day-to-day practice, in children's, in geriatrics, in old people. The remedy is antim tart. So let us start the discussion with antim tart. So Dr. Phatak in his introduction described mainly as it is a action on the mucous membrane, remedy for the mucous membrane of bronchi, mucous membrane of lung, mucous membrane of stomach. It is not just a cough remedy. This is a remedy of great accumulation of the mucus, impeded respiration, defective oxygenation, cyanosis, depression of vital power. So this patient, these patients are weak, drowsy, sweaty, trembling, lack of reaction. Great accumulation of the mucus with coarse rattling is the key. So it means that chest is full, sound is loud, but cough is ineffective. That is the identity of the antim tart. So the central theme of antim tart is overloaded and exhausted. Overloaded with mucus, overloaded with weakness, overloaded with pathology, overloaded with suppression, and exhaustion in reaction, vitality, and mental sphere. So this is not an aggressive remedy or this is not an high reactive remedy. It is a collapsing remedy. Patient feels don't disturb me, don't look at me, don't talk to me, but at the same time they are clinging to the attendants. Contradictory, yes, clinically important. They don't want to disturb, don't want to look at, don't want to talk, but cling to the attendants. So, too much mucus with little power to expectorate, chest rattle, but patient is collapsing. So, in the mental totality, Dr. Phatak described as a fear of being alone, cling to the attendant, peevish, winning, despondent, muttering delirium, conscious veins on the closing eyes. So, now, Dr. Phatak says that child continuously wishes to be carried erect, carried erect. The word is important, carried erect, unwilling to be looked or touched. This is the characteristic. So, in physical generals, now let us understand the thermal state. Aggravation from warm room, aggravation from warm wrap, aggravation from overheating. Better by sitting erect, expectoration, vomiting, lying on the right side. Although chilly and sweaty, still aggravation in the warm room because room increases the congestion and suffocation. Thus, less often drink small quantity frequently in fever cases. Craving for apples, fruits, and acids. But that disagrees, that is the classical of antimonium. Sleep, great drowsiness, yawing with complaints, shocks on falling asleep, cries during sleep. This drowsiness is not peaceful sleep, it is a toxic sleep, cola sleep. So, in energy level, extreme prostration, Phatak clearly mentions that trembling of whole body, faintness, relaxed, lack of reaction. If you remember one general symptom, profound weakness with rattling in the chest. In head symptoms and face symptoms, pale face, bluish, covered with cold sweat, sticky and sunken. This is the collapse phase. Nose, alienacy, flapping, nostril dilated. This shows that the respiratory distension. Tongue, thick white, pasty, red streak, teeth marks. In respiratory is the core symptom of. In respiratory symptom, coarse rattling cough, chest seems to be full, must sit up to breathe, suffocative shortness of breath, expectoration thick but difficult. Cough followed by vomiting or sleep, child becomes backward while coughing. This is bending backward is very characteristic. So you may see in bronchitis, capillary bronchitis, pneumonitis, pneumonia, emphysema, pulmonary edema, asphyxia neonatal. When you see the rattling, cyanosis, weak pulse, cold, clammy sweat, think of tartar, antimonium tartaricum. In digestive sphere, many of us think that only respiratory remedy. It is a mistake. Phatak clearly mentions that the strong gastric symptom, and clinically this remedy is often stands in the stomach and ends into the start in the stomach and end into the lungs. Nausea and vomiting pattern is the key. Nausea comes in the waves with weakness, with cold sweat, followed by vomiting, then exhaustion, and then sleep. So, characteristic is nausea comes in the waves with weakness, with cold sweat, followed by vomiting, and then exhaustion and sleep. So, a patient may say, doctor, first I feel sinking, then nausea, then I vomit forcefully, then I become extremely weak and sleepy. So, in vomiting, better by lying on the right side. After vomiting, aggravation after anger and vomitings. So, vomiting is exhausting. After vomiting, the patient looks drained. This is not like ipecac. Remember, this has aversion to milk, aversion to the nourishment. So, if child with bronchitis refuses milk and rattling, then think of antimonium tartar. Erections bad like eggs, sulfuric smell, very useful in the gastric and respiratory symptom combined. Thirst pattern is either thirstless or small quantity of thirst. Do not ignore this in the fever cases. Abdomen and stool complaints. Abdomen feels full of stones, violent colic with drowsiness, green mucus stool, diarrhea during eruptive diseases. Green stool in the children, drowsiness, rattling in the street, very characteristic. So, Dr. Phatak mentions that palpitation during stool. This shows that the weakness of the heart. In convulsion, a suppression theme, convulsion with eruptions fails to appear. Convulsion in children, if attended to thirst open them. Puerperal convulsion better after child is born. When the eruptions are delayed or supplayed, internal pathology increases. Measles suppress, smallpox suppress, skin eruption disappear suddenly, and then lungs suffer. So, in skin symptoms, pustular eruptions, blue end scars, thick eruptions like pox, smallpox, impetigo, delayed and receding eruption. Let us understand this pattern. This is not an effective this is not an active inflammatory skin. This is a weak, unhealthy skin. Eruptions like blue, thick, slow, leaves algae scars. When eruptions go inside, lungs get affected. So, in modern clinical correlation, bronchopneumonia, as I have already said, pulmonary edema, severe bronchitis, COPD, these are the acute gastritis with collapse, neonatal respiratory distress. Pathology behind is the overproduction of the mucus, poor expectoration, reduced oxygen exchange, carbon dioxide retention, systemic weakness. This is why the patient is drowsy, sinus, cold and clammy sweat. So, this is not just a cough, it is a failure of oxygen state. So, we must differentiate the antim-tart with some another remedies like ipecac. So, ipecac in mental level, antim-tart is drowsy, weak, collapsing. Ipecac is irritable, restless, not drowsy. Antim-tart has nausea, vomiting and sleep. Ipecac has continuous nausea, vomiting does not relieve the symptom. In chest, rattling with weakness in antim-tart, rattling with spasmodic cough, that is in the chest. So, ipecac fights antim-tart, collapse with the cough. So, another comparison with antim-tart is opium. So, antim-tart has face with bluish, pale, sweaty. Opium has dark red, congested. Consciousness, antim-tart has semi-conscious, weak pulse, while opium is deep coma, snoring respiration. Antim-tart reaction is some reaction but weak. Opium has no reaction. Opium is blocked, antim-tart is exhausted. Another remedy is antim-crude, as we discussed in the last episode. Let us again revise it. Antim-crude has overeating, thick white coated tongue, irritability. Antim-tart has nausea with collapse, prostration, drowsy. In chest, antim-crude has no strong respiratory symptom but strong bronchial remedies antim-tart. Antim-crude is digestive excess, antim-tart is respiratory exhaustion. So, rattling in the chest, ineffective cough, great weakness, drowsiness, cold clammy sweat, aggravation in the warm room, better by sitting erect. These are the keys to the antim-crude. So, if chest is full of mucus and patient is too weak and bring out, this is not miss remedy. So, vitality is good, it is not antim-tart. So, low vitality remedy in heart paralytic depression of the heart. Phatak gives an important phase of paralytic depression of the heart. It is not an inflammatory heart or it is not a violent palpitation. This is a weakness of the heart power. So, the cardiac key features of the cardiac is great precordial anxiety, palpitation with loose stools, weak quick pulse, sensation of coldness in the blood vessel. So, heat is coming from the heart. So, this circulatory weakness lead to blood is properly oxygenated. So, that leads to cyanosis, cold clammy sweat, weak pulse and trembling. So, you may ask to the patient, is the heartbeat is strong? Patients replies that digest, doctor, it feels too weak, I feel empty here. So, it is not anxiety based palpitation, it is the exhaustion based palpitation. In respiratory cardiac correlation, why does the heart suffer? Because of the lung are full of mucus, oxygen exchange is reduced, carbon dioxide is increased and blood becomes poorly oxygenated. So, the heart is struggled. So, Dr. Phatak mentions that defective oxygenation, cyanosis, depression of vital power. So, this is a systemic collapse. So, in the neck and back symptoms, violent sacrolumbar pain, slightest effort, retching and cold sweat, sensation as if heavy load hanging from the coccyx, vertebra feel rubbing. In extremity, peripheral circulation is weak, trembling of the hand, finger icy cold, numb, dry, hard, feel to go sleep while sitting, dropsy of the leg, synovitis, swollen joints. So, in urinary sphere, burning in the urethra, last drop bloody, pain in the bladder. In male, orchitis, pain in the testes after suffrage gonorrhea, warts on the glands. In female, leukorrhea, watery, bloody, aggravation by sitting. Puerperal convulsion, better by after delivery, cold creeping before menses. So, fever pattern is very important. So, lead to how Dr. Phatak described it as copious cold clammy sweat, coldness with trembling, burning sensation, heat from the heart, great drowsiness with complaint. So, this is not a high reactive fever, it is a low vitality fever. In fever, patient is pale, sweaty, weak and drowsy. Temperature is not very high, but patient is look very sick. Don't judge by thermometer, judge by vitality. Then sleep pattern, great drowsiness, shocks while sleeping, asleep, cries during sleep, lies on the back. So, in pediatric or neonatal symptom, asphyxia neonatum, child is breathless, pale and when born. This is very important clinical remedy. Pale baby, weak cry, poor respiration, mucus obstruction. So, this is again not a diagnosis, but because of the totality. So, in the deep pathological condition, mucus accumulates, patient not expel, need to explain, and uh, heart weakness, brain dull, drowsiness increases the collapse and tendency. This is a chain. Understand the chain, you can understand the remedy. So, chest is noisy but cough is ineffective and patient becomes increasingly sleepy. So, as we already discussed, the Antimca tartaricum is another remedy. We must differentiate Antim tartaricum with carbovage. Carbovage has very in air hunger. Antim-tart want to sit up, rattling in the chest. Carbovage wants air, fan, oxygen and cold extremity. Antim-tart has collapse from mucus obstruction and carbovage have collapse from circulatory fever. So, carbovage wants air, antimonium tart wants to drown in the mucus. So, in the remedy relationship, Dr. Phatak gives a complementary remedies Baratakap, Ipecac and opium. So, with Ipecac has bronchitis, early stages Ipecac has spasmodic stage, later stage has collapse stage of antimonium tart. With opium, with respiratory depression, severe respiratory depression cases, opium picture may convert into the enteral tab when mucus get accumulated. With Baratakap in elderly patient with chronic bronchitis, low vitality, enlarged gland, this remedy complement each other constitutionally. Related remedy, Asculus, ammonium carb, Dr. Phatak list, Ipecac, lobelia and opium. So, among the related remedy, mucus weakness and circulatory disturbances. For example, in lobelia, respiration is difficult but gastric involvement. But lobelia has most spasmodic, and Antim-tart has most collapsing. So, this is what about Dr. Phatak describes in Antimonium tartaricum about the other remedies. So, in potency selection, we must I usually use the potencies which are mainly 6 potency. In elderly patient 3x potency, 30 and 200, 1m, 10m 4 doses in the childrens with severe rattling cough gives very good result. Also in the 0/1 or 2 potencies in the children, depending upon the case we can give the potency, but 30 potency is the best with all these conditions. And then 10m 4 doses of in rattling children gives very good result, or you may give that antimonium tartaricum in 0/1, it will give good result. So, antimonium tartaricum has acute or chronic bronchitis, then have COPD type. So, in deep-seated diseases with COPD, respiratory failure, in chronic cases, you need to go to the lower potency 630, or in some cases 3x, and then if good vitality, go to the higher potency. So, golden pearl for prescribing the antimonium tartaricum is rattling in the chest, want to carried upright, drowsy, sweaty and bluish. So, what we see in these antimonium tartaricum when patient enters into the OPD, what type of picture or what type of presentation that people will bring or patient will bring to the you. So, pale or bluish face, cold clammy sweat, half closed eyes like drowsiness, weak posture, wants to sit up. You can hear with stethoscope coarse rattling in the chest, weak ineffective cough, low voice. What do you feel? Weak rapid pulse, cold extremity, trembling. These are the confirmatory signs when we see the patient. So, prescribing totality, great accumulation in the chest with of mucus, rattling respiration, ineffective cough, marked weakness, drowsiness, cold clammy sweat, aggravation from warm room, and better in the sitting erect. So, the let us speak the whole remedy in patient is overloaded with mucus, unable to expel that mucus, oxygenation is reduced, heart is weak, brain is dull, becomes drowsy, sweaty and collapse. So, these are the type of pictures we can see. So, let us understand some one acute scenario when the patient came with a 2 years old child. Patient's mother said that, doctor, he is coughing, chest sounds full, but he is become sleepy, he wants to be carried upright. You can examine rattling in the chest, cold sweats on the forehead, weak cry, bluish sleep. Now ask, is there is ipecac? But ipecac is restless and constantly nauseating. Is this opium? No, opium is deep unconsciousness with stertorous breathing. Is this carboage? No. Carboage wants to fan, wants air, extreme air hunger. This is a mucus obstruction with collapse. Think of antimonium tart. So, how can we prescribe or do mm, mm, differentiation of the remedy in this way? Let us understand the one chronic case. A old man comes with recurrent bronchitis. So, in above pediatric case, I myself I will give 10 potency 4 doses and say to report me after. Also, I will advise him to X-ray chest, CBC, CRP, urine, other test. So, let us understand the chronic scenario for this type of cases. So, a old man with recurrent bronchitis, trembling of the hand, thick expectoration, weakness and cold extremity. Sometimes constitutional prescribing needs to this type of remedy. So, in this type of we have to give 6 potency or 30 potency with frequent repetition 3 times or 4 times day, and we may think of complementary remedies like baratacarp in elderly with granular weakness with chronic bronchitis, ipecac with spasmodic state before collapse, when opium deep unconsciousness state. So, related remedies with mucus weakness and suppression. So, but antimtart stands out in rattling and drowsy collapse. So, these are the differentiating points we need to learn while prescribing or while seeing the patient. The scenario or differentiating remedy by asking question positive or negative, and leading needs to needs in many of our literature says that don't ask leading question, but for the differentiation of remedy we need to ask a leading question. So the core of the antimonium tartaricum is the drowsy, rattling and prostrated. So when the lungs are drowning, when the heart is weakening, the brain is dulling and patient is sleeping quietly, then think of antimonium tartaricum. So this is all about antimonium tartaricum. Uh, this remedy is a great remedy in day-to-day practice, but understand clearly, not prescribing every cough remedy everywhere there is cough. So need to understand a clear picture of that state of the antimonium tartaricum, and it will give you a fantastic result. It will revive many cases of children who needing to the hospitalization, oxygen support, and you may save the many save the lives and money of the patient. So thank you very much for patience listening. Thank you very much. See you in the next lecture.